Today has been a showcase of work that's been produced over 2019, and it was part of our participatory arts programme. This strand was the Artist in Residency programme, and we had 4 artists in residence working across St Mary's Hospital, the Manchester Royal Infirmary and Royal Manchester Children's Hospital. I'm a printmaker and I decided to set up this printmaking project off the back of my own passion and ambition towards print. And the new works that have been produced today are in response to those artists working over a 10-month period on the wards with the staff and with the patients. In addition to the residencies, we have set up a printmaking studio on site here at the hospital. So the printmaking studio is for NHS staff to come over and work with professional artists and printmakers and learn about all the different printmaking techniques, so screen printing, etching, monoprinting, whatever technique it might be. They're coming over and taking time out of work, after work, just having a really nice time.
I did quite a few of those workshops actually, and they were really good fun. So usually in the evenings, it was that period when staff had just finished their shift and were letting off steam, so they were generally quite lively, good-natured, and it was a good way of bringing staff together from all different kind of parts of the hospital that might not necessarily interact.
It's been really amazing, from working with nursing staff and getting them to be creative and enjoy kind of printmaking. That's been an amazing side of it, through to getting an insight into kind of a completely different environment really to that of an artist, and being able to produce work in response to that has just been really amazing.
I've absolutely loved it. It's been really good getting staff involved, allowing staff time of their day to be creative and to sort of look at the experience of being a nurse and the emotional labour of being a nurse.
It's about expression, and I think if you're expressing yourself, then it's good for you physically as well, and also socially and communally. And I think it's good for the staff who work very hard together on the medical side. It gives them another perspective on it, really.
It's fantastic, especially seeing about all the other artists and the work that they've been doing on different areas and different wards within the other hospital sites. We think about seeing all the work together, about seeing all the words that the patients have picked, about how they were feeling, and how powerful it is seeing all those block colours and those block emotions there in front of you.
You know, people really open up sometimes and telling the most extraordinary things, and it's a testament to people's ability to look after themselves and to accept help, I think.
Yeah. All the feedback was extremely positive. The ladies really enjoyed having something to do, something completely unexpected. They felt the time passed quicker, they felt a little bit more relaxed from chatting with Lisa, our wonderful artist, to being able to create something that they could keep and they could take home. And you'll see some of our artwork displayed along the corridors and hopefully in our waiting rooms as well for future ladies to see and to enjoy.
My involvement in the exhibition today was I created a happening, if you like. So I made a series of costumes and choreographed a parade, a little kind of mini parade, alongside a musician, Chiz Termos, who developed some music, sort of discordant music. And the idea is all based on chop-ups, cut-ups of fairy tales and cut-ups of fairy tale narratives that are being spliced back together in kind of spooky and unhinged ways.
I'd like to see just more of exactly the same, more artists doing different things with the staff, people getting an opportunity to get involved in artwork and to express their creativity, but also recognising that nursing is hard and sometimes you do need a little bit of a break. You need the opportunity to do something different.
The idea is now we've got these 2 spaces in the corridor, these in the hospital, these 2 corridors. I'd really like these spaces to be acknowledged as official gallery spaces, hospital gallery spaces, and we keep making work and curating exhibitions in those spaces. That's always a collection of staff, patient and artists working together. And I also hope that we can get more funding so that we can keep delivering the ward-based work and keep the artists here that we've worked with this last year and get new artists and start to develop this sort of tiered training programme so we can expand the creative workforce and professionalise the artists in the hospital, essentially. Make it an acknowledged and recognised profession, you know, artist in hospital. That's the plan.
Take me to the key.